All right, so let's talk about how to schedule a clinical shift on FISDAP. There's going to be little caveat to this. These clinical shift does have to be approved by your site coordinator. So if it's Mary at Central Tech, if it's Consuelo at OPSU, whoever it is, and if you're a KTC student, it's me, you have to be pre-approved and scheduled by that person to go to the shift before the shift starts and before you put it on this calendar. So this calendar is for approved shifts only. So once you've been approved to go to that shift and it has been set up by your site coordinator, this is how you're going to put it into FISDAP. You're going to log in, go to your shifts, your schedule, and then up here you see these plus buttons, field shift. So that's for EMS field or capstone, clinical shift, which is for any hospital or facility clinicals, and then lab shift, which is our skills days. So the only one you can enter and add a new one of is clinical shift. So you'll click new clinical shift. You'll pick the site. So all the sites that we have approved will be on here. Sorry. So we'll get all of these on here. So I want to go to this hospital and I want to do an ICU clinical on this date. You pick the date that's been approved. Don't add anything that is not approved. I want to start at 7 in the morning, 24-hour time. Nothing else goes in there except what time. And this is where you're going to get some of your hours from. So I'm going to do a 12-hour shift. So add in only numbers, and that's numbers in hours. Hit save, and it should be on your calendar. So if we look, I already created one shift. So when we click on there, I already made the Carl Albert shift earlier. And now down here you see the Eastern Oklahoma ICU shift. So whenever you're there, it's just like a skills day. Click on it. Go over here to the badge, skills and patient care. And now you are literally in the same as your skills day. So now you have the option to add patients first, because we're going to be adding patients, not necessarily skills. There is a way to do that. Attachments, and then quick add skills, and then your evaluations at the bottom like they always are, even on your lab days. So whenever you go up here and you're ready to add in a patient, I'm going to show you something really quick that kind of will tie in with this in just a minute, but it's the requirements. So these are the requirements as far as what kind of patients do you have to see and where are these populations going to come from. So these are the age ranges up here, and I'm going to put a copy of this in your every clinical packet that you have, so you just kind of heads up as to what your age ranges are and your clinical requirements. So here's how many newborns you have to see, how many preschoolers, how many adults, how many geriatric. So these haven't changed from moving paper to FISDAP. It's exactly the same. Here's some requirements down here, and I want to pay really close attention to this. A student will get credit for the following complaints if he or she has performed the patient interview and performed the patient exam. You can't just walk into a room with a chest painter and just count it automatically. You have to do an interview and you have to do an exam of that patient. And that becomes pretty important when you document it, because if you don't document those two things, you will not get credit for seeing that patient no matter what's wrong with them. The same with the impressions, and there is a difference in a complaint and an impression. So a complaint, a patient is complaining of chest pain and they're complaining of shortness of breath. On one patient, you have two complaints there, so you can count both of those complaints. An impression is what you thought was wrong with them. And again, you cannot count an impression unless you did the interview and the exam. So if you think that chest pain, shortness of breath complaint patient was actually a cardiac patient, then your impression is cardiac. If it gives you the option for a secondary, then you can put respiratory, and it'll take both of those numbers off of there. So keep this in mind. The big thing is you did the interview and you did the exam before you're allowed to count these off your competencies. Skills the same way. These are minimum requirements for skills. Remember, we may add more to these as we go through the phases of clinicals. So the point is, get as many skills as you can. If it only says 15 and you have 15, that doesn't mean don't record that next IV, because by the time we get to field, we may raise medications from 15 to 25 or 15 to 50 periodically as we go out through this. Do as many skills as you can is the big takeaway, because if you get to the end and we bump it up for whatever reason because of a standards change, then you're going to be left out in the dry. When you actually did those skills, you just didn't write them down. Down here, team lead, this will not matter until we get into field. So there's that. I just kind of wanted to show it to you. Again, it'll be in your packets whenever you get those and print those off. So we're back into this shift that we created, and we're ready to start logging some patients. So if I go in to see a new patient, say we're in the ER, patient comes in the ER, click add a patient, and it's going to open up a patient care report that has two sections. Section 1 is just the documentation, and then section 2 is the narrative. Both are required. Do not turn in a run sheet without a narrative, and the narrative needs to be a good narrative. It doesn't need to be one sentence. Patient had chest pain, seen in the ER, gave meds, whatever. 2 sentences, 1 paragraph, it's not going to work. So you do have to actually add information about the patient just like you were taking care of them in the field. So right here, preceptor. If your preceptor's in here, which we don't have any set up for the field, you'll be able to get them from a drop-down box. But if they haven't been put in yet, you can click Add New Preceptor. So we're going to add a new preceptor in. The big thing here is I want put the work phone number in there so that we can get a hold of them. This way we can call and audit your shifts and that kind of thing. And if there's a problem, make sure this information is true and correct. If we call and there's not a Joe Smith that works there, there's going to be a problem. So anyway, save that. The first section here is the one I told you about that was very important. I did the interview or I did the exam. If you didn't do the exam, don't put it down. Just get those competencies later. I do not believe that every patient that's going to walk through the door you're going to see and examine. So that's kind of going to be a red flag thing. But if you do, put it down. So click both of those. If you did both of those, you come down here. The patient required an airway intervention. If so, click that. And it's going to ask you questions about that. If they didn't, don't click it. So was the patient alert and oriented? You can click no, and it's going to ask you to what and what. That's fine. Fill it in like it goes. It's a bunch of check boxes, really. So age and years. So if you put this as a 5-year-old, 1 month, or you can just put 5 in there, it's going to take that off of your pediatric count for that age group. So you don't have to do that math in your head. So a 5-year-old male, Caucasian, and his complaints. So remember, this is what his complaints were. We'll change this to a 55-year-old male. His complaints were chest pain, shortness of breath, and nausea. Well, you just got 3 things checked off out of your competencies. Don't start checking erroneous things. Make sure it all lines up together. But don't be scared to check these things. So chest pain. Somebody's having chest wall pain from pneumonia. Yes, that is a pain in their chest, counted as a chest pain. Somebody's short of breath from their anxiety attack. That is a breathing problem. Yes, counted as a breathing problem. When you move down here, impressions, remember, so he's having chest pain, shortness of breath, nausea, and vomiting. Your impression is your field diagnosis, basically. So what do you think it is? Well, I think it's a cardiac issue for primary, and secondary, I think it's a respiratory issue. So that's what you get there. Criticality, this is asking you to triage the patient. So criticality for this one, we'll put yellow. We come down here to our vitals and interventions, and this part's really important. This is where you're going to start recording all the interventions you do, and this is where you're going to get, if you do an IV, this is where it's going to come off your counts. If you do an IO, it's where it's going to come off of your counts. So vital signs right here. The big thing is if you want credit for any of this stuff, you got to click I obtain the vital signs. So we'll put in a blood pressure. We'll put in a pulse of 100, regular and strong. Change this to what it is. Actually do assessments on these patients. So he's breathing 16 at normal. He was 99%. Always click more. If you turn in a set of vital signs without filling out the rest of this, we're going to kick it back to you. If we don't accept a patient, it will come right back to you and you'll have one opportunity to fix it. If you don't fix it within a timely period, we're just going to delete that patient out of there. So 0 to 10 pain scale, he was a 7. In title, if you did it, do it. If not, leave it off there. His temperature was 99.2. We'll leave that on there. Skin was clammy, pale, cold, we could say. Pupils were, yes, equal. Yes, they were round. If you didn't do it, put it as NA. Don't lie about stuff you did. Lung sounds were clear. Blood glucose was 110. APGAR is not applicable. And his GCS, which is now required nationwide, is 15. All you do is hit save there. It's going to save that set of vital signs just like any PCR. The good news about vitals is you can, to add another set, you can actually copy. Just hit this copy button right here, this duplicate skill, and it will add another one in there. Then you open it up and you can change. So the second time it was all pretty much the same, except that now his blood pressure was 114 over 78, his pulse was 98, his respirations went down to 12, and his SAT was 100. So go in here and we gave him some fentanyl in the meantime, and his pain came down to a 2. and you just save it. Now it puts in a second set of vital sign. There's no patient in the world, in the ambulance or in the ER, that's only going to get one set of vital signs. 3 is the minimum. Every patient you enter must have 3 sets of vital signs. It's too easy to enter them, and you need to be checking them anyway. Moving on down to airway. If you do an airway intervention, remember, you perform the treatment. If you didn't perform the treatment, don't check it. Just record it for this patient. And so if a doctor does an intubation but won't let you do it, then record it as you did not perform the procedure. So you go down here, and we can say that they did a oral tracheal intubation right here. So they did an intubation. It was an 8.0 tube. They did it in 1 attempt, or you did it in 1 attempt, and it was successful. So we'll save that, and there it is. And it's going to timestamp all this stuff and kind of put it in as you do. So if you do cardiac, I interpreted this rhythm. If this is a complaint above the waist, it does require some kind of strip to be put in. So it doesn't matter if it's a 12 lead, which is ideal. That's what we want. Once we get through cardiology, 12 leads are the standard. Put in a 12 lead and then interpret it here. Make sure you note that that was a 12 lead. You did it. And if you did any of this, chest compressions, defibrillation, pacing, whatever. So we did manual, and you can go through here and change it to whatever you need. And there's just a ton of options there. Play around with it, that kind of thing. Oh, we didn't perform a procedure. Save. Venous access is in here. So I performed this. If you performed it, if you didn't, don't record it as you performed it. Don't lie about skills. We always find out. Your buddies sell you out before anybody else. So was it an IV and IO? We'll say IV in the AC on the left side. We did it in 1 attempt, and we did a 20 gauge, and we did normal saline lock, and it was successful. Save. Now you just recorded that. It didn't take you 1 second, and it came off of your count, so you're doing better. We gave a med to this chest painter. I performed it. We gave him aspirin. We gave him 324. I don't know if it'll take milligrams or not. We'll see. Route PO. So there's that. And then we gave another med here. And we gave him some Zofran, 4 milligrams IV. Somewhere. IV bolus. Excuse me. IV push. And then we'll say that we gave him some fentanyl for pain. So there's all your interventions there. We can go into other, and you can kind of look around in here. Play with this as you go. This will be kind of just random stuff along the way. So if you did capnography and you actually viewed that, put it down here. You never know what the next rollout of requirements will be, and you never know if it's going to hit during your class. So if you've done capnography, it would be really easy just to pull it up and say, well, they did that. They don't have to go back and get more. So make sure you put in every single thing you do. So get to know, every time you enter a patient, go through this menu right here and look through it and make sure there's nothing that you can put on there. All the way up to doing an MD consult, like for medical direction. So once we're done there, you can go to the narrative right down here. You can either click next and it'll take you to narrative, or you can roll to the top and hit narrative there. And now you're going to write a good run sheet. So 55, and I kind of type in all caps. It's up to you on this. 59-year-old male presented to the ER with complaints of chest pain, shortness of breath, accompanied write your whole run sheet. Go down through here. Interventions as recorded, vital signs as recorded. This is what the plan was. This is what we assessed. This was the disposition of the patient. He went to the cath lab. He went to the ICU. He went home. All of that's in there. So how did you find him? What did you do for him? What did you test? What was the outcome? And then what was his final disposition? So if you're going to add another patient, click here and it'll open you a new run report, or click review shift documentation. And then go back to your shift list And you can go back into it here. And you're back to where you started. So if you want to add another patient, add it, no problem. Attachments right here. So if you do an EKG, if you have a chest pain or you have a shortness of breath, yes, you need a strip or an EKG. Once we get through cardiology, you need a 12-lead EKG in there. On this is where you're going to upload all of those. You cannot take a chest pain call and not have a 12-lead. There's no way. That will get sent back to you or kicked out. So on your iPad, you can do this no different if you use an iPad. Click choose file, and you can take a picture of it already. I don't really have one here. We'll put this in. We'll call it an EKG, and we'll put it here, and this is going to be so you can see back over here patient 1. So we can put patient 1 EKG 1 and hit save. And if we do patient 1 EKG 2 and we have a separate one, we can put it in there. So that'll be that. Now, quick add skills. I don't want us to use this as much as we can. I'd rather you see the whole patient. But if you go in a room and they're like, hey, we're going to do an IO in this room, and that's all we're going to let you do, then okay, go in here, click this, and this just lets you add a skill without writing a run report. But remember, you will not get credit for your chest pains, for your shortness of breath, for your children, all of those things without going up here and adding a patient and writing a run report on them. So you go in here and say they're going to let you start an IV. I did this in the hand. I did one attempt. It was an 18, and I did a saline lock. It was successful. Save. So now you just added that in there, no problem. Whenever we get to the end for the day, a few things on here that will be here. One, preceptor evaluation. So this is something for you to fill out about your preceptor, and is required every day. It won't let you lock it without it. So you grade them. Be honest. This is where we get the feedback from. And the hospitals actually want this feedback. Site evaluation is where you evaluate the clinical site itself. So the hospital, the clinic, the EMS site, whatever it is, and you can grade the actual agency there. Facility evaluation of the student right here. This is where they're going to grade you. So you're going to hit go on this. Change the evaluator if you can. If not, just leave it on your name. That's fine. Excuse me. Change it to preceptor, and then if there isn't one there, you just pick that facility, and then his name or her name should pop up there, and you do the date and fill it out. They fill it out on you, so they need to sit and fill this out, and that's how you're going to get your grade for this. Submit and close. And it's actually here if we refresh this. So there it is, done right there. You can't get back into it once it's submitted. And when we're done with this whole shift, we're going to go up here to detailed shift report. Remember that this is where your shift ID is located also. You'll need that for your paper form. So click detailed shift report. You can kind of review everything that happened on the shift if you want to, or if they want to. When they've looked at this and approved it, you go up here to sign off on the shift. And we're going to do it by signature. So if it's somebody that we have here that's a skills instructor, they can use their login and password. If not, we're going to go to signature, and they're going to type in their first and last name. You're going to click the lock tab, and then they're going to sign their name, something like this. Hopefully it looks a little better. They're going to do that. You're going to go to attach, and you're going to add another attachment. And this is going to be the paper out of your packet for that skills day. So you're going to add a picture of that paper that you take with your iPad. It's shift documentation, and this is my paper shift summary or something like that, because that preceptor is already going to have signed the paper part as well, and it's a backup. So if anything ever happened to FISDAP, you have a backup in paper as well. To some degree, it's not near as detailed. So then hit sign off. Remember that this is already locked. What do we got? It's not going to let me lock it because I didn't enter an eval on the preceptor. But that's how it's going to end. So if you got those evals done, if it ever says this, the problem is that you probably haven't done the evals correctly. So go back and make sure that you have done your evals. But that's basically it. I know it seems like a lot, but once you do it a few times, it won't be. Really work on writing those run reports. That's one thing we get a lot of feedback from EMS companies on about students is they need to be better prepared to write electronic run reports. So this is the place we're going to do it. If you write a bad run report, it's going to get kicked back to you. You're going to have to add an addendum and make it to where it's workable. So work on that stuff. Don't try to shortchange it. You might get through a few times, but we are auditing them, so they will get sent back to you. Make sure you holler at me if you have any questions.